Hi, I'm Mahbod. I'm a nephrologist with Dallas Renal Group, and I'm a fellow in the GlomCon Glomerular Disease Fellowship for 2020 to 2021, and I'll be discussing the predictors of end-stage renal disease and lupus nephritis. Lupus nephritis is common in patients with systemic lupus erythematosus, and renal damage is an important predictor of mortality in these patients. Kidney involvement in lupus can be clinically variable and range from a silent nephritis to a rapidly progressive glomerular nephritis to a nephrotic syndrome or a combination. Patients with lupus develop end-stage renal disease at a relatively young age. Costin, Bader, and colleagues found via the US renal data system that the average age of onset of end-stage renal disease in lupus nephritis is 41 years old, and thus these patients represent some of the younger patients that we see at the dialysis clinic. Risk factors for progression to end-stage renal disease are not limited to clinical factors, but also include demographic and socioeconomic factors. The treatment of lupus nephritis has changed substantially since the 1960s, when Pollock and colleagues first classified lupus nephritis based on histopathology on the kidney biopsy. Since then, efficacious treatments have been utilized to significantly improve the mortality in lupus nephritis. However, it must be noted that there are economic, social, and behavioral factors that do affect the access to care and adherence, and therefore the risk of progression. In this review by Nataski and Eisenberg, published in 2015, a table summarizes the prognosis of lupus nephritis. We know that age is an important predictor, as renal disease is more frequent and severe in patients with childhood onset lupus than adult onset. And we know that adults who have nephritis onset at a younger age have a poorer prognosis for their kidney disease. Late onset lupus is associated with fewer major organ manifestations. Men with lupus have more frequent and severe lupus nephritis than females, and it is unclear how much biology, such as hormones, play a role, or if this is related to delay in diagnosis, differences in treatment-seeking behavior or adherence. Black and Hispanic patients have higher rates of renal disease and mortality, and it is an area of needed ongoing study to determine the role of genetics and biology, such as genetic causes such as APOL1 versus socioeconomic and sociocultural factors. We know that class 3 and class 4 lupus nephritis are associated with progression to end-stage renal disease, as is chronicity on the index biopsy. Chronicity is defined as tubulointerstitial damage or interstitial fibrosis and tubular atrophy. Interestingly, one study found that 13% of patients with lupus who had an eGFR greater than 60% actually did have moderate to severe tubulointerstitial damage on the biopsy. Therefore, this calls into question the potential role for protocol biopsies, given that at least in these 13%, their moderate to severe chronicity was not reflected in their eGFR. Tang and colleagues have created a risk per progression prediction tool that utilizes the detailed pathologic lesion score that's outlined here over the pathologic subtype to try to predict risk of progression. Interestingly, although serum complement levels may be helpful in clinical monitoring of lupus, the renal deposits of complement did not predict end-stage renal disease and death. Socioeconomic status can be quite difficult to measure, but may play a role in the risk of progression to end-stage renal disease. In 2007, Ward performed a cross-sectional study examining associations between medical insurance and socioeconomic status with the age of onset of end-stage renal disease, and they found that patients with private insurance had the onset of end-stage renal disease 8 years later than patients either with no insurance or Medicaid who had similar time of onset of end-stage renal disease. And thus they concluded that private insurance was a factor that contributed to the progression to end-stage renal disease. Genetics have been found to play a role in lupus, in the development of lupus, and specifically the FCGR genes, which are a family of immunoglobulin Fc receptor genes found on many immune response cells, have been associated with end organ damage, including end-stage renal disease. In the profile cohort, which is a multi-center, multi-ethnic cohort, which has been studied since 1998 and represents a variety of ethnicities, the FCGR3AGG was overrepresented in patients who developed end-stage renal disease. And of course, we must take into account the effects of treatment, given that the goal of treatment is to delay or prevent progression of lupus nephritis to end-stage renal disease, and thus the treatment that the patient has had up until the current time certainly should be taken into account when determining what their risk to progression to end-stage renal disease might be. This figure from a review article by Meraz and Segal sums up the different potential demographic, clinical, histopathologic, and other factors that can contribute and help us predict the progression of lupus nephritis to end-stage kidney disease. And many are an area of ongoing research. And I would like to thank Dr. Ting-Ting Lee and Dr. Michelle O'Shaughnessy for their guidance and contribution to this presentation. Thank you.